looking at some anatomy in the hip, we see a lot of people get really tight and through here. And one of the reasons for that, if you come in here on the Visibody, is you can see how far down the glute muscle, which I've got highlighted in blue here, and you can see underneath it all these rotator muscles, and here's your sciatic nerve. The glute actually comes all the way down to about here. And what happens is it tends to get really glued down to the hamstring underneath here. And we're going to show you a way to release that with the foam roller.
Hey, just a real quick way to release
The back side of the hip here. It's a little bit of an anatomy lesson. Your glute comes all the way down to about here. So we see a lot of people have just a lot of scar tissue and things get really glued down in here. And it's kind of a neglected area with the foam roller. Most people tend to focus up in here. Just remember that it comes all the way down pretty far. So what you want to do when you're just working in the piriformis, the hip rotators, is to come down below the trochanter, which is at the hip joint. And below that, and then from there, I can just kind of back and forth here, okay, and just work, peeling all that away. Spend about a minute here, okay? So remember that what we're trying to do is wind up the tissue. So we're winding up the fascia, and then as we're back and forth here on the roller, that's what's eventually going to help to release all of that so that we can move a little bit better. Back that up with some banded hip mobility stretches. We'll put a link in the description here to that video. Start with this, unglue all the tissue around the hip, finish with some banded hip mobility, and get yourself moving better.